Hello, my name is Dr. Vinay Bhat. I'm a consultant surgical gastroenterologist and GI oncologist at Aster CMI Hospital, Hebbal. Gastric cancer or stomach cancer is the fifth most common cancer across the world. The number of patients being diagnosed with gastric cancer is on the rise. This rise can be attributed to several factors, including obesity and dietary factors. Patients who are obese have a much higher risk of developing gastric or stomach cancer. Patients who consume a diet rich in processed foods, salted or smoked foods also have a very high risk of developing gastric cancer. In addition, alcohol, smoking, H. pylori infection, and a strong family history also contribute to an increased risk of stomach cancer. The early symptoms of stomach cancer are often non-specific and can mimic common conditions such as reflux disease, peptic ulcer disease, stomach or duodenal cancer. The symptoms that we commonly associate with gastric cancer include jaundice, abdominal pain, blood in the stools, vomiting, or weight loss. Unfortunately, these symptoms usually represent an advanced stage of gastric cancer. The treatment options for gastric cancer depends on the stage at which it is diagnosed. In early stages, the treatment could be endoscopy. In advanced stages, the treatment would involve surgery, chemotherapy, or radiation, or a combination of all of these. Staging or diagnosis of gastric cancer can be made with an endoscopy and scans, which would include a CT scan or a PET scan. The outcome of any patient depends on the stage of the tumor and the amount that it is spread. Slow-growing tumors have a good prognosis. Fast-growing tumors have a poor prognosis. Tumors that have spread have a poor prognosis. Tumors that are picked up at an early stage have a good prognosis. In order to stage these tumors, like I mentioned earlier, we do an endoscopy, which would involve passing a pipe down the throat into the esophagus or the food pipe, into the stomach and beyond to look for whether there are any ulcers, nodules or abnormal areas. Sometimes we do advanced endoscopic techniques such as narrowband imaging to screen these patients to see whether they have early gastric cancer. We can also stage patients with gastric cancer with imaging such as CT scan or PET CT. These tell us how much a tumor has spread, whether it is spread to local organs or to distant organs. Based on this staging, we would offer treatment to patients who have been diagnosed with gastric cancer. The treatment options include endoscopic treatment, surgical treatment, radiation, or chemotherapy. Surgical treatment of gastric cancer involves removal of a part or the whole of the stomach along with the lymph nodes to which it is spread. This surgery can be done robotically, laparoscopically, or as an open procedure. The choice of surgery would depend on the stage and patient-related factors. As a patient, you would need to visit a GI oncologist if there is a strong family history of stomach cancer, if symptoms are persisting beyond 2 weeks despite traditional treatment, or there are multiple risk factors for gastric cancer. To conclude, with multidisciplinary care, gastric cancer is curable.